Good morning, everybody. I want to welcome each and every one of you here this morning to our hearing on the President's fiscal 2015 budget request for the Departments of Veterans Affairs. Mr. Secretary, we're glad to have you back with us here in the room. I appreciate your attendance and that of your entire leadership team. We've only had a short time to review the details of the budget request, so I'm sure that we will likely have some follow-up questions after the hearing, and as usual, I'd ask for you and your folks' cooperation in trying to get the answers to those questions to us as quickly as possible. In a fiscal climate that has regrettably seen budget cuts all the way to the bone, funding for our veterans is emerged as an obvious priority for both the administration and the Congress. For that, I commend you for your leadership in fighting to ensure that veterans of this country remain a priority. I also want to commend VA on the operation of its Veterans Crisis Line. I've heard some really positive feedback in the most recent days. Paul Rykoff was testifying in the joint hearing over in the Senate, and your statement that roughly 35,000 men and women have been rescued from suicide because of VA's intervention. It's the rough equivalent of 2 Army divisions, and certainly that speaks for itself and is a great success. So with that, we say keep up the good work. Now, I've listened carefully in the last few weeks to testimony from a whole myriad of veteran service organizations who testified before our committees regarding the need to improve timely delivery of mental health care, to ensure that health care is delivered in state-of-the-art facilities, and to sustain VA's progress in reducing the the backlog that exists out there, but making sure that we have timely decisions and accurate decisions on the backlog of claims that exist out there. When I look at this $163.9 billion budget request, I'm left wondering why we can't do better than we are in some areas. I think it's fair to say that Congress has supported nearly every request that the administration has asked for when it comes to our veterans, yet I think we can all acknowledge that serious problems still exist within the system. Although it's nice to see a steady downward trend in the backlog over the last year, what I'm hearing from veteran service organizations and veterans themselves is that VA is sacrificing accurate decisions for fast decisions, and that it is falling behind on appeals. With the record funding provided in this area over the last decade, both in manpower and in technology, it is frustrating, I think, to all of us to continue to hear some of those same complaints. I'm also concerned about continued Inspector General and media reports regarding preventable deaths at a number of VA facilities across the country. And I know that VA is not infallible, but serious, even deadly mistakes merit swift and clear accountability. I know you believe, as I believe, and we're ready to work with you and your agency to give you any of the tools that you need in order to get the job done. I'm going to follow up on this last issue in questioning, but I am troubled with what appears to be a common practice with VA's budget submissions being late. And that's to identify, based on updated information, excess funds that are no longer necessary, then redirecting those funds toward initiatives that were budgeted and appropriated in advance at a lower level. For example, VA overestimated by about $700 million what it needs for long-term care resources in fiscal year 2015. But now the agency wants to redirect all of that money and more towards its homeless initiatives, facility activations, and other needs. In fact, notwithstanding the overestimation of $700 million, VA now seeks a supplemental budget for fiscal year 2015 of $368 million. Needless to say, I think this practice needs further discussion. Mr. Secretary, these are just a couple of areas I'd like to address with you this morning. In the interest of time, however, I'm going to recognize the ranking member for his opening statement.
Thank you very much, Mr. Chairman, for holding this hearing, and thank you, Mr. Secretary, and the panel for being here this morning as well. Mr. Secretary, I'd like to begin by noting that in your written statement, you applaud, I quote, Congress's foresight, end of quote, in providing for advance appropriation for the Department of Veterans Affairs healthcare budget. This committee is again trying to show that foresight and looking down the road and providing advance appropriation authority for the remaining 14% of the Department of Veterans Affairs discretionary budget. As you know, H.R. 813, the Putting Veterans Funding First Act of 2013, would give the Department of Veterans Affairs a certain and stable budget. It would also implement some vital planning and programming provisions. You have seen firsthand how valuable these can be. Help us help you and the veterans you serve by coming out today in support of H.R. 813. This morning we are discussing the budget for fiscal year 2015 and 2016. Mr. Secretary, two of the VA's top 3 goals have due dates in 2015. Eliminating veterans' homelessness and eliminating the disability claims backlog. My question to you, and in perspective, is I believe that we should take in regard to this hearing is, does this proposed budget provide the Department of Veterans Affairs with all the resources needed to meet both of these goals in 2015? If not, now is the time to let us know what you need to meet both those goals. I have been a champion, as you know, of improving access, especially for rural veterans, since I first came to Congress in 2003. As such, your third goal of improving veterans' access to benefits and services is of a special interest to me. Today, I hope to receive some assurance that the Department of Veterans Affairs is pursuing new technologies, infrastructure, and construction management process that will increase access to all veterans. And finally, in December, the Department of Veterans Affairs issued a final rule granting a presumption for certain illnesses relating to traumatic brain injury. In the past, the Department of Veterans Affairs has pointed to past presumptions for leading up to the disability claims backlog. And today I look forward to hearing what advanced planning you are doing to ensure that this does not happen again when you look at presumption as it relates to TBI. And Secretary Shinseki, this will be the 6th time that you've come before this committee to discuss the Department of Veterans Affairs budget. More time than any other previous secretary. So I applaud you for your willingness to serve as a secretary for that many years. And I want to thank you for your continued service to our veterans and to the Department of Veterans Affairs and to the nation. And I look forward to your testimony today. And with that, Mr. Chairman, I yield back the balance of my time.
Thank you very much, members. At this time, I want to recognize our first and only panel that will be with us this morning. We're going to hear testimony from the Honorable Eric K. Shinseki, Secretary of the Department of Veterans Affairs. Accompanying the Secretary this morning is the Honorable Robert A. Petzel, Undersecretary for Health, the Honorable Allison A. Hickey, Undersecretary for Benefits, the Honorable Steve L. Murrow, Undersecretary for Memorial Affairs, Ms. Helen Tierney, Executive in Charge for the Office of Management and Acting Chief Financial Officer, and Mr. Stephen Warren, the Executive in Charge for Information and Technology within the Office of Information and Technology at the Department of Veterans Affairs. Secretary Shinseki, you are now recognized for your testimony, sir.
Well, thank you, Mr. Chairman. Chairman Miller, Ranking Member Michoud, distinguished members of the committee, thanks for this opportunity to present to you the President's FY 2015 budget and FY 2016 advanced appropriations requests for the Department of Veterans Affairs. As the Ranking Member noted, I'm working my sixth budget cycle with you, and together we've made a lot of progress. I express our thanks from all of us at VA. We deeply appreciate your unwavering support for our veterans, and our past 5 years of work, I think, reflects a good bit of that commitment. Let me also acknowledge the representatives of our veteran service organizations who are here today. Their insights and support make us better at caring for veterans, their families, and our survivors. Mr. Chairman, thank you for introducing the members of my panel here, and I have a written statement which I ask to be submitted for the record.
Without objection.
Thank you, Mr. Chairman. The FY 2015 budget and 2016 advance appropriations requests demonstrate once again President Obama's steadfast commitment to our nation's veterans. His leadership and the support of the Congress, and especially members of this committee, has allowed us for 5 years now to answer one of our abiding guides, and that is President Lincoln's charge from 149 years ago to the American people to care for those who shall have borne the battle, their families, and our survivors. I thank the members for your commitment to veterans and seek once again your support for these budget requests. The President's vision reflected in these budget requests is about empowering veterans to help lead the rebuilding of the middle class in this country, much as they did following World War II, through access to quality health care, benefits, training, education, and employment that enabled achieving the American dream. VA's 2015 budget requests seeks $163.9 billion, $68.4 billion of that amount in discretionary funding, including medical care collections, and that's an increase of 3% above our 2014 enacted funding level. And the other piece of that budget request is $95.6 billion in mandatory funding. This budget also requests $58.7 billion for the FY 2016 advance appropriations for medical care, an increase of $2.7 billion or 4.7% above the 15 budget request that we're submitting today. This is another strong budget, and your support of it is critical to providing veterans the care and benefits they've earned through their service and sacrifice. It enables VA to further the three significant top priorities that we have discussed budget after budget cycle here, and laid out for you our plans and our progress. The first is expanding veterans' access to benefits and services. The second, eliminating the disability claims backlog in 2015. And thirdly, ending the rescue of homeless veterans in 2015 as well. Since 2009, we focused the resources you provided to address these three key priorities. Among other requirements, these three have been the driving force behind our efforts to serve veterans better. And where it comes to access, I would report that more than 2 million additional veterans have enrolled in VA health care. We opened our 151st hospital, our first in 17 years, and we have increased our community-based outpatient clinics by a net of 55, bringing our total CBOCs today in this country to 820. More than 1 million veteran and family member students have received VA educational assistance and vocational training. Nearly 90% of all veterans now have a burial option within 75 miles of their home, and our plans are to increase that to 96% by 2017. So just a way ahead beyond these budget requests. In terms of disability claims, the backlog has declined 40% in the past 12 months. We're transitioning from paper to digital processing, and we are on track to end the backlog in 2015. In terms of veterans homelessness, the estimated number of homeless veterans fell by 24% between 2010 and 2013, and we expect another reduction when this year's count, point-in-time count, which was taken in January, when that is tallied, we expect to see another reduction. Well, these are some of our key accomplishments. The momentum is up. I think we're making good progress across the board, and we will continue to leverage every resource in these budget requests to do what's right for veterans. In closing, I would say, as we have for 5 years now, I assure the committee that we will use these resources that the Congress provides effectively, efficiently, and with accountability to best care for veterans. So again, Mr. Chairman, members of the committee, thank you for the opportunity to appear here today and for your continued support of veterans. We look forward to your questions.
Thank you very much, Mr. Secretary, for your testimony. I'm sure we all have a significant amount of questions that we'd like to ask. If I can, I'd like to talk about Senator Sanders' legislation that he had proposed, Senate 1982, on the floor a couple of weeks ago, which incorporated a number of House bills that have passed this committee and the full House, and we have actually sent it over, and we await the Senate's response. But I, like many committee members here, support a great number of the pieces of legislation that Senator Sanders had. But I'd like to get your take, if you would, on some of those pieces that he included. I think it was in Section 301 of the bill, mandates the enrollment of certain Priority 8 veterans by December 31st of 2014. And I noted that the administration embarked on a limited expansion of Priority 8 veterans being able to use VA about 5 years ago. So my question is, does the administration support an expansion beyond what you have already allowed? And if so, what resources would be required before such an expansion could be accommodated without negatively impacting existing health care being provided to users within the system?
Mr. Chairman, when we focused on Priority Group 8 veterans 5 years ago, we had a number in mind that established a goal, what we thought we would see join us. In many ways, the specific focus on Priority Group 8 veterans became somewhat less focused because many ended up in other higher categories and therefore were able to join us. And we exceeded the number of veterans we thought would be in this Priority Group 8 category. I think it was about 500,000. That was a rough target that we thought would respond incrementally over time. I would say that today, over the last 5 years, we've had over 2 million veterans join VA's roles for health care. And so while we've exceeded the number, a little bit of the priority group focus was addressed when veterans qualified for other categories.
But going back to category,
we met the initial milestones we set.
Correct. And I'm just saying now, if we expand it beyond what you had already opened up, what would the agency need in order to expand for all Category 8s?
I don't know that we've made, financial assessment to respond to that question.
Would the administration support opening up for?
I would be happy to, provide an estimate of what the cost might be, but I have not done that personally.
And in Section 303 of the bill, it expands the caregiver program to all eras of veterans. And I note from a report from last July, I think it was, that VA says they cannot responsibly advise the Congress on expansion without realistic consideration of the resources necessary to carry out the expansion. So in the same report, it stated that VA believes that expansion poses the risk of compromising resources needed for its core veteran health care mission. So my question is, do the administration now support this provision?
Here again, Mr. Chairman, I think when we put the program together, we expected about a 3,000 population of caregivers that would meet the requirements of the law. Today we're over 13,000, and I just share that with you to understand how popular and how helpful this program has been. To the degree we can, we are interested in helping all of our caregivers who have responsibilities for veterans who have served this country, and I have an appreciation of what caregivers have to go through. This is a good program, and I'm happy to work with you in answering that question.
And one other real quick question is, part of Senator Sanders' bill provided dental care as well, and my question is, do the administration support that provision?
Mr. Chairman, dental health care is part of our health care program, so we provide dental care to veterans today. It is based on service connection for dental work, and so I would try to understand what the qualifying conditions would be.
And it's a comprehensive approach for all veterans to get all dental care provided, so it expands way beyond those that may have received some type of injury in their service.
Sure. And I would say there's a way to work, with you and also the other body to get language that makes sense for providing the best quality health care, which includes dental health care for our veterans.
Mr. Michaud.
Thank you very much, Mr. Chairman, and thank you again, Mr. Secretary. The VA State Home Construction Grant Program Priority 1 list for fiscal year 2014 lists a total of $489 million in waitings for VA funding. Projects are waiting for our funding. You have requested $80 million for this program for fiscal year 2015, $5 million below the 2014 levels. In light of the backlog of nearly $500 million in projects for fiscal year 2014, what do you anticipate to be the total of unfunded Priority 1 projects for fiscal year 2015 if you indeed receive $80 million?
Well, Mr. Michaud, we have a prioritization process here, and this is a program that we work in collaboration with the states, and there may be a long list of projects that we see on the list. Some of them we are on hold until states can generate their portion of the funding, which we then intend, it's our responsibility to try to meet. If you have a specific state home in mind, I'll try to address that question.
Well, actually, the Priority 1 list shows that in 2014 a backlog of $489 million. Priority 1 applications are those that already have state matching funds in place. So the state matching funds are there. You have that huge backlog currently, and my only concern is you're only asking for $80 million, which is $5 million less than it's a $5 million cut from previous years. So there already is a huge backlog with state funds available. And the issue here is GAO just came out with a report that shows state homes provide a cost-effective long-term care for our veterans. So I have a concern with this huge backlog already out there with state funding available that you're asking for less money than what you received in the previous year.
Let me give you a better answer for the record. As I say, we work these off, and priority, a good bit of work that goes into this. I would say every now and then we have projects that fall off the list because something happens and we move projects up. But no question, there is a long list of things we would like to do. We pay for 65% of these projects, which is a significant investment, by the federal government.
Okay, yeah, if you can get for the record, I appreciate that.
Right.
I also understand that the non-VA care coordination is designed to ensure a more effective procedure to third-party billing and also oversight of the continuity care for our veterans. VHA has been rolling this program out over the last year. Can you give a status update on non-VA care coordination initiatives?
Let me call on Dr. Petzel to do this.
Thank you, Congressman Michaud. the VA spends approximately $6.8 billion a year on non-VA care in a variety of different programs. The thing that I think you're talking about directly is the approximately $5 billion that we spend on non-VA medical care across the country. And in order to provide better access for America's veterans that live in rural parts of this country so that they can have care that's very similar to the care that you can receive in a less rural, more urban area, we have developed a program called Patient-Centered Community Care, or PC3. PC3 provides for a standardized way of physician asking for community care or a patient asking for community care. A structured referral with a very clear template for what needs to be in the request. And then we go to the network that's been developed by the two contractors that we have, HealthNet and TriWest, to identify the providers within their network that can meet the need in whatever part of the country it might be. It is going to provide better access for veterans that live in rural America, better choices about where they go, and much more timely service. We have in the contract a number of requirements regarding timeliness, reporting, etc. To date, about 5,500 individuals have been involved with PC3 contract and PC3 care. They started in January with the beginning of the rollout of TriWest Network, and now HealthNet's network is out as well. We expect that this is going to be an important part of reaching particularly specialty care into rural America for veterans that live in those communities.
Mr. Lamborn, you're recognized for 5 minutes.
Thank you, Mr. Chairman, and thank you all for being here and for your service to our veterans. Last night I had a telephone town hall meeting, and one of the questions that came up is the impending construction of a new National Veteran Cemetery in southern Colorado in El Paso County. I want to commend and thank Undersecretary Steve Murrow for his hard work on this project. And veterans and active duty folks are very excited about how that is coming along. So I commend you for your contribution to southern Colorado and veterans living anywhere near there. That'll help reach that 96% goal that you mentioned, Mr. Secretary, of people living within 75 miles of a National Veteran Cemetery. Changing subject, I was a little concerned to hear that there are continuing, well, not little, I'm very concerned, that there are some continuing issues with quality control over claims processing. And an example recently in my office back in Colorado Springs is a veteran who waited a year for the claim to be processed and then was told that he didn't produce enough documentation about his service in Vietnam. And he had served in Korea, and that was what his claim was based on. Now, maybe that was a typo, or maybe it was actually a sign of inadequate claims processing. I know that you have a tremendous need and desire to work through this big backlog that we have, but I want to make sure that we're not sacrificing, and the chairman brought this up a minute ago, quality over quantity over quality. How would you respond to that, Mr. Secretary?
Let me begin, and then I'll turn to Undersecretary Hickey. Congressman, I will tell you that no veteran should have to wait for benefits and services we provide that they earned a long time ago. And so we are committed to making that available as quickly as possible. The other aspect of that is not going so fast that you lose control over the precision of getting it right. And for us, getting it right, the goal is getting it right the first time through. Not only is that better for veterans, but it also improves our efficiency. Anytime you have to handle the same claim more than once, it's an increase in workload. We in the VA, we're about 1/3 of us, about 100,000 of us are veterans. And so looking after Veterans claims issues are something we spend a good bit of time on. 50% of VBA are veterans. And what you're describing is a lack of precision on a point. I'd like to get some more details on this.
Okay, we can provide those to you.
And I'll ask Secretary Hickey to talk about the overall accuracy picture.
Thank you, Congressman. Thank you, Congressman. And as the Secretary said, our VBA employees are 52% veteran, and many more a direct family member of a veteran or a family member of a serving military member, and all of them care deeply about delivering both a timely and an accurate claim decision for their brothers and sisters whom they've served alongside. Let me just tell you very quickly that our approach and method for determining our quality has both been audited and validated by an external agency outside of VA, and it's been found to be statistically sound, highly reliable, not only for the defined governance process, but also for the accuracy of the results. And it does cover the complete body of claims that we do across the board. Your budget help over the last couple of years have allowed us to take additional steps to improve that quality. The budgets associated with training have allowed us to stand up challenge training for all of our new employees that lets us improve the skills and abilities of our folks. We've made an investment in quality review teams at the individual regional offices that have caught errors before they become final. Which is a great way to make sure that doesn't end up in a problem for our veterans. Also, we have begun a new process in this last year called consistency studies, where we send out a scenario and we ask everybody to do the exact same scenario, and then we look at the consistency of the answers and apply direct training all the way down to the employee level if necessary to improve on the consistency of the responses.
Okay, I see we've run out of time, and I was hoping I'd be able to yield some additional time to my colleague from Colorado, but I can't do that. So, Mr. Chairman, I yield back.
Thank you very much. Mr. Tucano.
Thank you, Mr. Chairman. I'm not sure who to direct my question to, but I presume it's Ms. Hickey. Is the VA working on fully completing the long-term solution for the post-9/11 GI Bill claims so that automation will include original claims and supplemental claims?
So thank you, Congressman, for the question on that. Long-term solution is VA's paperless IT system that has been put in place to help our student veterans and their family members go to school in a timely way and in a high-quality accuracy decision. I can tell you that we have put in new capability into the long-term solution that allows now more than 80% of our claims to go through with the benefit of automation that allows us to get those student veterans going to school very quick answers and highly accurate answers. So right now, we have actually exceeded for more than a year now the agency priority goals for both timeliness and accuracy for those student veterans. And so our long-term solution is proving its value for both original claims and for supplemental claims.
Well, how far along are you towards completion of the solution? And if you still have further to go, how much longer will it take, and how much more money will it take to complete?
Let me ask our IT expert to address that.
Thank you, sir. Right now, the system is we have it in sustainment or in operations mode. As Secretary Hickey walked through, we build to what the performance goal needs are. So today, it's exceeding what's needed. So as a result of our internal prioritization of resources, we move the IT dollars to hit what isn't meeting our goals or targets we've set. So today, we're sustaining the system. We're making updates to it as needed, but with respect to new capability, that is something that's probably projected for the out years, because today it's doing the job, it's moving those claims through, and as Secretary Hickey talked about, tremendous amount of automation such that as soon as it comes in, it moves through, and we're able to get the dollars out to those veterans so they can take advantage of that great benefit.
So are you telling me that it's complete for the moment?
It is complete for the moment. It meets what our mission needs are. And if the mission needs change or if legislation comes in that requires more, then we would go back and relook at where we placed our investments to meet those needs, sir.
So you don't need additional funding at this time?
At this time, for the goals that we set, it meets those goals, so we have funding needs and appreciate your support for that to continue running that system in terms of paying for the underlying, but with respect to new investments right now, there are none planned, sir.
Well, I congratulate you if you've achieved your goals, and I'm pleased to hear that. Do you think that this budget and everything that the VA, the Department of Defense, and the Department of Labor are doing to improve the transition process is enough? So, Mr. Secretary.
Let me start, and then I'll call on Secretary Hickey to provide some detail. This program we've just started this program about a year ago, and the program is designed to take care of the transition of every service member leaving the military. So the Transition Assistance Program, which is a DoD program, has VA representatives as well as Department of Labor representatives inserted into the training that goes on for every service member. Every departing service member gets a departure physical, something that was not done before. And so we have a pretty good idea of what the needs are going to be. And then the transfer of this information to VA is much better than it's ever been. Your question about is it all that we need it to be, it is what we design, understanding what we thought the needs are, and we will learn as we execute the program, what needs to be adjusted. So we're still gathering data, and then DoD has just announced that they will be looking at a downsizing requirement, which will then allow us to understand what our requirements are going to be for throughput, and we are working with them right now to understand what that plan is.
If I may, and I'm going to run out of time, my suggestion is that maybe service members should be encouraged to start thinking and preparing for the transition much earlier than they are.
I agree. And those are discussions that both VA and DoD have, and understand those encouragements occur while they're still in uniform, and I know that is a priority at DoD.
Thank you. Mr. Chairman, my time is.
Dr. Benishek?
Thank you, Mr. Chairman. Well, I was looking at the overall numbers here, and I'm a little concerned about the care of our veterans and the medical aspect. What percentage of the new employees that you're planning on hiring will be actual medical care providers, and what percentages are the administrative staff?
Let me ask Dr. Petzel to discuss that.
Thank you, Congressman Benishek. I would have to go back and look at what the planned 40,000 or so hires that we probably will make over the next year. I don't have in my mind the figure, but let me just relate the fact that when we underwent the mental health hiring initiative starting in March of 2012 in order to provide better access for veterans to mental health care, we hired what eventually turned out to be 2,400 clinical professionals in 6 different clinical categories, and about 600 administrative people to help support those. Now, whether that plays out in our entire hiring, I would have to go back and look.
Well, I would appreciate to be able to see what those kind of numbers look like, because, as you know, I'm interested in making sure that the people, you run an efficient program, and that there's more healthcare providers than there are, clipboard carrying bureaucrats. The other question I have, to tell you the truth, is a little bit more about the PC3 program. I've asked, I don't remember who it was I asked about the implementation of the program and the amount of people that are actually going to participate. And I'm a little concerned over what's it going to cost the VA to have this intermediary. I mean, there's 2 contractors, right? Was it TriWest and HealthNet are the 2? There are only 2 providers in the entire country then? I mean, can you tell me why that is? And kind of what is the percentage of that they're going to be taking of the VA's money to just organize this network?
Thank you, Congressman Benechek. There are two networks. There are literally thousands of providers around the country. We negotiated with those two organizations to basically have very close to Medicare rates for reimbursement. We can't get anything better than that. They then go out and negotiate with individual providers to join their network. So we're expecting, quite frankly, that we're going to save money over what we have spent in the past in non-VA medical care in those areas where we do use the contract.
Well, that's my concern. You know, if they're going to be paying providers less than Medicare, are you going to get providers to actually sign up?
To date,
How many, like in my district, as you know, is very rural,
Right.
and you know, many of my veterans want to have access to, you know, multiple facilities like the X-ray and Sault Ste. Marie, rather than to drive to Iron Mountain. So are you going to be able to get, you know, the Sioux Hospital to provide an X-ray when it's going to be paying them less than Medicare, maybe more close to Medicaid rates? Are they going to want to join a network like that?
we believe that this is going to do a better job of providing access across the country for veterans. So far, the networks have been very successfully set up according to the two network providers. And we have been able to, we've had about 5,500 people actually use this, and we have been able to
5,500 providers or 5,000?
5,500 patients since we've just gotten started. And we have been able to meet the needs that were identified for those patients within the network. So I'm expecting that, again...
It sounds like a very small number of patients, though.
Oh, it's just
Dr.
starting,
Bessel.
sir. Just starting.
Well, I think I'm very concerned about this process, and I'm concerned that there's going to be difficulty in getting enough outside providers. I understand the difficulty with the VA individually trying to contract providers on your own, because I've been a part of that, you know, as a physician working for the VA, and it's not easy to get the payments system arranged in a logical fashion. So I understand maybe the need for that intermediary, but I'm just concerned about people participating in it, frankly, because of low reimbursement.
Congressman, I would just, Dr. Petzo's our expert here on these things, but I would say if you look at our discussion of delivery of health care, this is one of the options where we try to get as much access to veterans and as many places as we can using the experience of these two networks. We also still have fee basis that we provide for those areas that don't quite fit.
Well, I guess what I would like is I'd like to have an update to me as to how much you're actually paying. Are you paying, if you're paying these guys Medicare rates, are they taking 20% of the money to provide the network to you? You understand? I mean, how much are we paying this intermediary to provide the care to our veterans? And you know, those are tax dollars these guys are making money on, and they're not actually providing the care, they're just signing everybody up. I just want to know how much of the take they're getting.
Yeah, as Dr. Petzel says, we're just getting started. We're happy to have that discussion with you.
Appreciate that. Sorry, my time is up. Ms. Brownlee.
Thank you, Mr. Chairman, and thank you, Mr. Secretary, for your testimony this morning. I remain concerned with the mental health care needs of our nation's heroes, and I know we've touched upon it this morning. 3 weeks ago, thanks to Dr. Benechek, we had a hearing in Ventura County, which is the district that I represent, and discovered that the response time in Ventura County is 44 days for mental health needs, as opposed to, I think, the goal of a minimum of 14 days. So I'm wondering, when we talked a little bit about the mental health initiative in terms of trying to hire more mental health professionals. So I'm just wondering, you know, what the VA's plan is to use the budget to make sure that we are meeting the mental health needs of our veterans, and sort of what metrics we're using to gauge that. Clearly, we discovered an area within California where the response and I think the number of FTEs are below what is needed to meet the demand there, and what's going to be done about that.
Congresswoman, let me just say that, we all know that we've been at war for a decade, over a decade now, and the great young people we send off have done fantastic jobs carrying the mission load that we've given them. And so after 10 years, we ought to be very sensitive to this area that you talk about. And I would assure you that inside this leadership team and throughout VA, this is something that we work quite closely. It's trying to understand, first of all, it's a difficult area, and secondly, exactly what will work. And one of the metrics would be what you're talking about is the full-time equivalent employees. But we have done other things. We have, in those areas where we have difficulty hiring providers just because they're not available, we are challenged, and we've set up a network where a virtual mental health connection can be made between an individual in that kind of a situation and the rest of the system where we have mental health providers, sort of a virtual mental health clinic. We, in our work, are a little bit reactive, and this is not an excuse. A little bit reactive because we look at who walked in for treatment this year and we try to adjust it for next year. We don't have a good metric for anticipating what next year's load is going to be. We put an estimate in there, but it's less precise than we would like. And so we are constantly having a look at ourselves, looking at those access metrics you describe. I'm going to ask Dr. Petzel to provide a little more detail here. But it's something we adjust over time, and we are looking at how we sit today.
Thank you, sir.
Dr. Petzel.
Thank you, sir. It is very important to us that we are able to provide good access to high-quality mental health services for these people who are returning from conflict. The Secretary mentioned multiple deployments, and the stress involved in their particular circumstance there make them very vulnerable. We're going to be spending about $1.7 billion to treat approximately 1.7 million patients with specialized mental health services. With the addition of the 2,400 people that I spoke about earlier, we have improved access across the country. We are not where we want to be yet, and there are places such as the Oxnard Clinic, which you and Dr. Benechek visited, where for new patients we are not meeting our goals of providing timely access. And there are places where we're doing an excellent job of meeting the goals of timely access. We're in the process of assessing those places where we're having difficulty to look at what the recruitment problems are and what the issues might be associated with not providing timely care. I know specifically in Oxnard, as we've discussed, there are plans to hire 2 additional psychotherapists, which should be able to then manage the individual psychotherapy needs for both PTSD and depression in that clinic and provide for timely access. So acknowledge the difficulties with Oxnard and also the fact that we're, I think, working hard to try and correct that situation.
Thank you, sir. My time's run out. I yield back.
Thank you, Mr. Kaufman. You're recognized.
Thank you, Mr. Chairman. Secretary Shinseki, as you know, there is current litigation between the prime contractor and the VA with regards to the cost of construction of the Aurora VA Medical Center. The prime contractor is arguing the cost is $1.1 billion, and the VA argues the cost is $600 million. Does the VA have a contingency plan if the prime contractor walks off the job or VA realizes a shortfall of between $400 and $500 million?
Congressman, this is in litigation, so I can't go into too much detail, except to tell you that for the design of the Denver Medical Center, a contractor was brought in early to help with the design, and it happened to be this contractor. And this contractor then was allowed to compete for the project and did, and signed the contract at $604 million. And that's the contract we're pursuing. We understand that because of mutual agreement about requirements to improve on the contract, that the figure has now been increased, I think, to $612 million. And this negotiation continues. We work with this contractor. It's our intent to do that. I've not heard from the contractor any indication that he is thinking about walking off the project. We certainly don't hope so, hope that isn't the case. We are committed to funding this project, and I would point out, as I mentioned to you in the past, this project didn't exist before 2009, and today there are pilings in the ground, and it's going vertical in about 5 years. I think this contract has done well. We just need to work out what is usually construction negotiation between the contractor and the government.
If the appeals court does determine that the cost is closer to $1 billion, then the 600, closer to the $1 billion figure than the $600 million that you've just referenced, would the VA have to ask Congress for additional appropriations to complete the project?
I will have to see, wait and see what the figure that comes out of the appeals process nails.
But if it is, it's not the question. The question is, if it is closer to $1 billion, would you have to come before Congress for an appropriation?
Hypothetical here, Congressman. I don't know. I'll have to take a look. I've not heard the $1 billion figure before.
But that's in the litigation.
Well, we have not accepted all of what the contractor said is part of that. So,
Mr. Chairman, I yield back.
Thank you, but I think the question is, if the courts rule that the agency owes an additional $400 million, would that require VA to come to Congress for additional funds?
It may, but I'm not going to speculate here today.
That's not a hypothetical. That's if the court rules. It says you owe it. I need to know. We need to know from an
authorization. We may reprioritize other projects, Mr. Chairman. Before I come back. Yeah.
Yeah, I missed.
We may look at reprioritization and come to you for reprogramming.
Reprogramming.
Yeah.
So, but you would have to come to Congress for reprogramming or reauthorization.
We always do, Mr. Chairman.
Of funds. Mr. O'Rourke.
Thank you, Mr. Chair. Secretary Shinseki, I'd like to start out by thanking you and commending you for your responsiveness to me and to our office in the many requests that we put before you. Commend your team collectively and individually for their responsiveness to us. We don't always agree with the conclusions that members of your leadership team reach. For example, Mr. Murrow and I have talked about regrassing the Fort Bliss Cemetery, which right now is xeriscaped and covered in essentially gravel and dirt. We'd love that to be regrassed, but we're working constructively with Mr. Murrow to try to beautify what is there already, and I think that holds true for everyone almost without exception. I'd like to go through a few of our priorities in El Paso, and I think they pertain to national issues and to the FY15 budget. The first is expanding capacity and quality of care, primary care at the El Paso VHA clinic, and ultimately we need a full-service veterans hospital in El Paso. Currently, when veterans need that kind of care, they're traveling on a 9 to 10 hour round trip to Albuquerque, New Mexico, which is the closest full-service VA hospital. We looked at the 14-day access numbers in El Paso for the last year. In October, only 18%
of the veterans who are trying to see a primary health care provider were able to get an appointment within 14 days. It's improved since then, thanks to Mr. John Mendoza and his wonderful team of doctors, nurses, and frontline staff in El Paso, but it is in desperate need of improvement. Second is we need to improve claims turnaround times out of the Waco regional office. It did go from a peak of 470 days that the average El Paso veteran was waiting to hear back on their claim last year to the current number, which is 288. So it's an improvement. It's not at 125, but we're moving in the right direction, and we thank Undersecretary Hickey and her team for helping us out with that. Third is the backlog on the IDES claims processing in Washington State that our wounded warriors who are at the WTU at Fort Bliss are languishing for hundreds of days beyond when they should be so that they can transition out and get on with their lives. We'd love your help with that and look forward to working with you there. And the fourth one, and this is where I want to ask my question finally, is on access to mental health care, and to pick up on something that Congresswoman Brownlee brought up. That is perhaps the most critical issue in El Paso, and I would guess in other VHA centers around the country. When I was running for office, I was approached by a young man who had just returned from Afghanistan, had PTSD, was using his post 9/11 GI money to go to the El Paso Community College. At night was flipping burgers at Carl's Jr. and said, I cannot get in to see a mental health care specialist. I'm supposed to be in every single week. I'm lucky if I get in every 6 to 8 weeks. When I get in, it's a different counselor each time. I have no continuity of care. If I could pay for this myself, I would, but I can't afford it. Will you help me out? That anecdote and others that I've heard have since been borne out by the statistics that we've seen. The recent SAIL report puts El Paso at 118 of 128 VHAs around the country for access to mental health care. We surveyed our own veterans population and found that a quarter of them could not make a mental health care appointment within 1 calendar year. So we have been able to work with Dr. Petzel on this. He's made a commitment to me and to my team that by May of this year, we will get to that 14-day number for 90 to 95% of the population. But my question for you, Secretary Shinseki, and for Dr. Petzel is, ours in El Paso, as I heard from Ms. Brownlee, is not a unique story. What are you going to do in addition to the additional $309 million that we're requesting in the FY15 budget for mental health care to surge providers access, care, and resources to these desperately underserved areas where we are failing to care for those who have borne the battle?
Dr. Petzel.
Thank you, Mr. Secretary. Congressman O'Rourke, we, as you've heard me say previously, are committed to providing access to these veterans who have suffered these invisible wounds of war and are now living often in, for our purposes in terms of not being able to leave in relatively remote areas. And we've talked about what we're doing in El Paso. Specifically, I would point out, and I think you know this, that the access has improved rather substantially since that survey that you did with your constituents. What we've done there is, number one, hired up to the ceiling that they have 80 mental health professionals, and number two is that we provided for a network of telehome health. Psychiatrist recruitment in El Paso has been difficult, and they're needed for medication management. We have now 2 telehealth providers, one in Salt Lake City, the other in San Diego, who are doing medication management and individual psychotherapy via telemental health very successfully. The patients like it. The service has improved dramatically, and the access now to those particular services. But I am empathetic with what your constituents have said. We need to be able to assure every veteran that they can get ready access to mental health services in El Paso as well as every other providing community in the country.
Mr. Runyon, you're recognized.
Thank you, Mr. Chairman. I'm going to have one question. It's probably more directed to Undersecretary Hickey dealing with VBA. And we talk about the processes and initiatives that are outlined in the budget and they're centered around concepts of centralization, national work queue, and centralized mail operations. The biggest question here is, get that. I think most people will ask, what are we doing to fix the systemic problem at, I've had the conversation with Ms. Titus, the Reno office. How are we addressing the underperforming things? Because from a big picture view, it looks like we're shifting workload away from them to just get the job done. What are we doing to address the actual problem in these underperforming offices?
Secretary Hickey.
So thank you, Congressman Runyon, for your question. And I will tell you, we are, the entire transformation effort, people, the most important piece of it, 52% of those people doing this job every day are veterans, and a large portion of them are a direct family member of a veteran or even a family member of a military serving veteran. So everybody wants to come to work and tries to come to work every single day to do the right thing by these men and women they've served alongside. So what I will tell you we have done is, and we have talked to you about this before, and we're seeing great merit from it. Challenge training, which this committee has supported in budget. Not a cheap venture, but a critically important piece of training our entire workforce, no matter where they sit, to do a great job every single day from the moment they join us in the workforce. We continue those efforts. You see it represented in our budget today for FY15, continuing to grow that way. We have taken and done, and thanks to this committee as well, and it supports station enhancement training, where we have gone into a complete office and we have stood down, and now we're doing a non-stand down form of that for other offices that are challenged, and retrained everybody top to bottom, including leadership, in all of their responsibilities in order to get a way ahead and a better result and a better outcome every single day. The other things that this committee has supported, frankly, and I need your support continued, is our IT budget. We have built rules into the IT systems that now make it easier to deliver on the right and accurate answer every single time. That's critically important in this 15 budget, because everything now in VBMS Forward is about automation and building those rules into the system, so it eases the burden of remembering a book bigger than the one sitting in front of me full of rules that are the complexity of this kind of business. So our IT budget is critical to that aim. We have also, and yes, we are helping across the nation all veterans. From no matter where we sit, we care about all veterans and every bit of those family members that are supported by that veteran, no matter the geography of where they sit. But first and foremost, the filter for national work queue is, can the regional office where that veteran lives near do that work? And if they have a surge because they've had a recent redeployment from a theater, some of our states have been impacted by a large National Guard redeployment at that time, and it puts a sudden surge in their system. Yes, we are helping others from across the nation, and we can now because we're electronic and because this committee has blessed us with the IT resources to build a virtual electronic system that allows anybody anywhere to help on that claim for that veteran, so it goes better and faster all at the same time.
Thank you. I yield back, Chairman.
Ms. Custer.
Thank you very much, Mr. Chairman. I just have a couple of questions, and I first want to just thank you for your attention, and I'm delighted. I just yesterday spoke with the new director at the VA in Manchester, New Hampshire, who's now finally been installed, and look forward to working with her as well. So 3 quick questions. The first has to do with acquisition of medical devices. We have a company in Salem, New Hampshire called Gamma Medica, and what they make is a medical device that produces bone density imaging to help with early detection of breast cancer. And the challenge has been 2-year-long delays at the National Acquisition Center and so that veterans are not getting the opportunity to get access to early detection of breast cancer. And I'm just wondering if there's anything in the budget that's going to help to speed up the processes at the National Acquisition Center.
Thank you, Congresswoman Custer. The need for timely purchase of medical equipment in order to be, again, able to meet the needs of veterans who are coming to our clinics and to our medical centers is very important. And I am familiar with, we have gotten some information about, and some letters from you about Gamma Medica, and are looking at what we call the NAC, the National Acquisition Center, to try and reduce this time frame, because 2 years is what it is taking us to acquire more costly medical equipment. We have 2 pilot projects with the NAC to have a streamlined approval process. And the second thing that we're doing is looking at unbundling. One of the things that takes time is that purchases are bundled in order to get a better price. And we're trying to find perhaps a compromise between getting those things done quickly and getting a good price. So I'm very familiar with that circumstance, and we are exploring ways to cut down on that acquisition time.
Thank you. The second issue is a focus that I've had with Representative Walorski and others in the Congress about military sexual trauma and sexual assault. This committee had a hearing with both men and women victims. And my question is, as more survivors and whistleblowers come forward, how does the VA plan to meet the growing need for mental health and other services for veterans that are victims of sexual trauma? And does this budget provide you with the resources that you will need to address these needs?
Congresswoman, thanks for that question. We've all learned a considerable amount in dealing with the issue of military sexual trauma. Serious, sensitive, greatly underreported. And so those of us are in the validation of a connection of something. We don't have much data to go on. And what I would say is that we have been very open about understanding this is a circumstance that doesn't lend to connecting dots. And so we have committed to providing access for care, both the physical medicine as well as the mental health aspects of this. And we have been, we provide this free of charge even if the eligibility to other services, VA services, are not being provided. Every medical center provides treatment, and they have a military sexual trauma coordinator. The same is true at each network, VISN network location. I'm going to call on Secretary Hickey to talk about the effort she went through in reviewing benefits decisions to ensure that claims for PTSD resulting from MST and PTSD from other primarily combat reasons. There was some comparative discussion here, and I think terrific work done on her part.
So, Congresswoman, when I arrived here in June of 2011, one of the very first things I did was call for a full review of all of our PTSD due to military sexual trauma decisions and asked for a complete statistically valid review of them. And what I found was a problem we had. We had granted these conditions lower than PTSD claims for combat terrorism, results of terrorism, things of that nature. So working with my counterpart in VHA, we took very aggressive action over the summer to completely revamp that whole program. We designated only specific people that can make those decisions on both sides. We brought them all together at the same time with both of us there at the training event to completely retrain that workforce from top to bottom. I put those claims in our special operations lanes where we have our most senior, most highly qualified individuals to be able to work with those claims. Together, working with our VHA counterparts in very quick timing, we closed the gap on that grant denial rate, and we have sustained that closed gap on that grant denial rate since. And so we are very focused on that. I routinely ask about every 6 months to review to make sure we're holding that effort close. Those folks we had made decisions on previously, we invited by letter, and we asked the VSOs to help get the word out, to come back to us if they felt like they were denied in error. We had some come back, and we have redone those. And in those cases, there have been grants at a higher level commensurate with how we are now granting and denying those claims.
Thank you very much, and my time has expired, Mr. Chairman.
Mr. Chairman, may I just add one last point here?
Yes.
FY13, we had a number of veterans coming to us to report a MSD prior history, for whom, for whom we had no documentation. So more than 77,000 women and more than 57,000 men came to see us in FY13. Our outpatient visit was significant, 16% increase over whatever had happened before. And so that has been put in the calculation for the 15 budget. And I expect that we'll have most of our requirements covered here. The other issue is we're going to watch this as we begin to see the downsizing of the military. And we'll expect to see more of these cases, but we are sensitive to it.
Thank you very much, Mr. Secretary, and thank you, Undersecretary Hickey. Thank you, Mr. Chair.
Ma'am, Dr. Rowe.
Thank you, Mr. Chairman, and I want to start by thanking you all for what you do for veterans each day in my district. We have, as you know, a large VA medical center, numerous CBOCs, and I know a lot of times you hear negative things, but when I go home, I hear many more positive things than I do negative things, and I think you don't hear that enough. I mean, you hear a lot of the complaints that go on, but I certainly hear a lot of very positive comments about the care that our veterans get in our area. Imperfect, yes, individuals with problems, but overall, it's been a very positive experience. I wanted you to hear that publicly. I think we mentioned a few things earlier about the caregiver program, a tremendous program that the VA has initiated to help veterans. The homeless issue is one that I will continue to work on with you, Secretary, as long as I'm here, and I know as long as you're here, that's a passion you have. One of the saddest things I think I can think of is a homeless veteran, a person who served this country honorably that now doesn't have a place to live. That is a very good VA VASH program is a tremendous program. And also the post 9/11 GI Bill Mr. O'Rourke brought up, I can't say more good things about that. Is an incredible educational opportunity. I know maybe others in this room have used the GI Bill. I remember I had $300 a month. I'll never forget the number, and it helped me tremendously when I got that, and it is a wonderful benefit. I think a couple of things I do want to talk about. What percent of veterans do we serve in this nation? Does the VA serve? There are 22 million veterans.
22 million veterans enrolled for health care, probably 8.9 million.
Right. So about
8.9 million. And
okay.
then over in our benefits, we have about 12 million who are enrolled for benefits, and some of these numbers
overlap.
Yes.
Sure. Okay, I appreciate that. Just a comment that Mr. Michaud made a minute ago, I wanted to emphasize of the state VA homes. That is, I have seen that where I grew up in Clarksville, Tennessee. They're beginning to build one there. And I want to encourage the VA to continue to invest in those as our veterans age. That is a huge demographic of people out there. And it's just the population in general. As we get older and we live longer, as a society, we're going to have to figure out how to take care of all these people in a dignified way. And I think the VA is a very good way to help with veterans, and I would encourage you to relook that number and see if more couldn't be invested along with state homes, since the state makes I know 65% is a lot of money, but the states make a huge investment. Just to comment there, I mean, nothing to do now, but when we look at future budgets, I would strongly encourage you to to increase that significantly.
We will look at that.
Thank you. I think two other issues I want to talk about are just briefly, and I guess this will probably Mr. Warren that will take this question, but as again, the interoperability, and we talked about this in your office, between DOD and VA. And would just briefly tell us where that is, because we spent $1 billion. We were here last year, and we don't know where the billion went. And we still can't interact. I know when the budget was passed, we put, Chairman Rogers put $300 million more technical dollars in to make this happen. Where is that for the record?
I'm going to call on Mr. Warren to talk the dollars that are being allocated. I would just say a quick look back here. When Secretary Gates and I launched this, we envisioned a single joint common integrated electronic health record. And pretty much we have worked on that project with that in mind. When Secretary Hagel arrived, he took a look at how he was structured to deliver his half of that commitment. And he didn't feel he was properly organized, so he asked for the opportunity to relook his structure. And his decision coming out of that, I respect his decision, was to pursue an acquisition strategy. We have had Vista, our electronic health record, since 1997. You know, technology turns over every 18 months. Some say that technology turn is moving closer to 9 months. But it says something about our electronic health record that since 97, it's been the one that we've been able to evolve into more and more capability. And so we're comfortable with it, and we're going to pursue raising Vista from a level 2 electronic health record to level 4, which would put it at the top of the, competitors.
We talked about this, and this is a critical decision because we've now been years trying to get this to happen to make veterans health care better. And I think this is one of the biggest decisions that from the VA standpoint, technologically, that will be made in my tenure in Congress, because I don't want to be here at 10 years if my voters will let me come back for another few terms, to be having the same conversation that we can't talk that we've had for 15 years. So.
Well, I would just say, Congressman, that these conversations don't just occur here. They occur between Secretary Hagel and myself. And what I will tell you is he is pursuing an acquisition strategy. I am evolving my Vista, which is at what was one time head and shoulders above everybody else. The gap's closed, but we're still a great health record. As he pursues his requirements for his acquisition, we are monitoring and having discussions, and if there's a capability there that he's looking for that we don't have, we're going to go after that and make sure that we include that. When we get to the point where he is ready to make a decision on the DOD electronic health record, we want to be in the competition, and I've talked to Secretary Hagel about that. He's assured me we're going to be in the competition. And so my work for the next 2 years is to get us as competitive as anybody else. We've taken our code, the MUPS code, that drives our VISTA program. We put it in the commercial workspace. Other contractors have picked up on it and have begun to incorporate that into their solutions. I think that makes it healthy. When we get down to the end, even if we don't get the nod, the differences between what we have and what's available in the commercial workspace, I think, is going to be pretty close just because of what is going on now. Our code is government-owned, government-operated, and we're comfortable with it. We think we're going to be competitive. But however it comes out, we're going to be very, very close at the end, even if it's not a single joint common electronic health record. The interoperability is going to be much greater than it is today. And I think you know, Congressman, we designed a joint viewer that takes our two databases now, and it sits so that a care provider can pull data from both and see in one screen all the critical data and make decisions that are required. And then that data goes back and resides in the proper database. We know that that isn't good enough, and we're going to be much closer here down the road.
The chairman's been very generous for this time. I yield back.
Here, Mr. Titus.
Thank you, Mr. Chairman. Thank you, Mr. Secretary. I've always been especially appreciative of your accessibility as well as your team, so thank you for being here. A lot of good points have been made today. I'd like to go back and just focus on a couple of them, maybe from the perspective of Nevada and the West. First, I have to take a little exception to your cemetery policy that says a veteran will be within 75 miles of a national cemetery. There's a big difference between a rural burial initiative and a national cemetery. And there will still be 11 states without a national cemetery, including 6 in the West. And if you look at the map, that covers an awful lot of territory. Second, I want to talk to the doctor perhaps offline because I want to get to national issues about our hospital in Las Vegas where there's some serious problems, especially with the emergency room coming on. So if we could meet about that, I'd appreciate it. Third, I'd like to thank Chairman Runyon for bringing up the point about the Reno office and the backlog. Our committee has been working very hard to assist you and do what we can to support your efforts to reduce that backlog, which you have done a good job of, and we appreciate that. And that's true in Reno, too, which was one of the worst places in the country. I support the brokering initiative, but I don't want this to just be a policy where we ship a lot of cases somewhere else where they're doing a good job and we don't fix the problem at Reno. So I was glad to hear the report of some of the initiatives that are taking place there. And when you look at state nursing homes, again, a problem we're having, and I think you'll see it nationally, is many of the veterans nursing homes are mostly contracted to the state and to Medicare, and they're the ones who do the accountability, and there's not very much of it. So if you look at that budget or look at going into that business more, I hope you'll build in some accountability by the VA and not just leave that to somebody else to check. And then finally, I would ask you this. I have a bill that's called Pay As You Rate. It's been moving forward out of this House, but where you can pay a veteran some of his benefits as you assess different parts of the claim instead of waiting till it's all finished to then give them some compensation. That way you get a little bit as you go along. Now, we talked to some veterans and found out that in Nevada, only 8% receive any kind of payment as you go along, even though the VA apparently can already do this. I understand it's something about the way claims personnel are paid or their claims are counted towards pay, or I can't quite understand why that is, but would you address it and let us know if there's some way we can fix it so that this could be a policy going forward?
Let me try to hit all the issues, and let me start with the claim-as-you-go payment that you brought up last, Congresswoman.
So, Congresswoman Titus, when we get fully into an electronic process, we're still sort of standing a foot in paper and a foot in the electronic process, and we are able to start really seeing, as we can now when we work a claim in VBMS, medical issue level capability where it could keep that claim, that medical issue could move forward without human intervention into and through a pay process. That is a long-term objective for us. Today, when we do it in paper, it means the person has to stop what they're doing to rate all the rest of the issues, take it to the next step manually. A person has to come off of doing a full authorization and award and manually paying the thing, and it becomes actually a process in a manual environment that could extend out the experience for the veteran and many more veterans. But in an electronic environment where you can move it faster into an electronic payment environment, that's exactly where we're trying to go, but we're not quite there yet. Next year, 15, with a strong IT budget, we get closer.
May I just address some of your other questions here? I would say your sensitivity about rural cemeteries is one that Mr. Murrow has brought up in the last 5 years. We looked at the way we have our population-based national cemeteries. So in a population cluster of 80,000, we tried to locate a cemetery within 75 miles of everyone in that cluster. We discovered what you just described, and there are whole states that don't have 80,000 veterans residing within a contiguous border, maybe as many as 8 states.
Yes, sir.
Yeah. So as many as 8 states. And so we began a commitment to put a VA cemetery in at least each state so that veterans could say they have a VA resting place that honors them. It's probably a poor choice in words to call it a burial ground because it seems like it's something less than a cemetery. If it's less, it's only by size because of the population that will use, that capability. We establish it in the same way we establish other national cemeteries, and we set a standard that is expected to be maintained for all of our national cemeteries. And whether that arrangement is out in a rural area or on tribal land, we have the same standard. So we're sensitive to your point, and we'll continue to work that, and happy to work with you on that as well. Elko, Nevada is one of those sites in which we have programmed to put, quote, a burial ground. On the emergency room in Las Vegas, before I arrived, I believe that facility, that entire hospital, was designed to be linked to the Air Force Hospital medical program at Nellis Air Force Base. Someplace along the way here, there was a change in priorities, and so we were required to build a freestanding facility of our own. That facility would have linked in with the Air Force Hospital, and therefore the requirement for a large emergency room wasn't necessary. Now that we were required to build a hospital in North Las Vegas, we put it up because the overall plan was good. We knew when we did that we were going to have to go back in and make the emergency room a little larger. Don't like doing that, but in this case, it was better to get the hospital up, take care of veterans, and then make the adjustment.
Thank you, Mr. Chairman.
Mr. Flores. Thank you, Mr. Chairman. Mr. Secretary, thank you for joining us today, and I thank all of your team for your commitment to our nation's veterans. I do have one question that is a non-budget related question related to the VA nursing handbook. We'll send that to you supplementally and ask that you respond to that. Also, my next question is well, before I do this, let me echo what Mr. O'Rourke said. I want to thank you for your commitment to the Waco Regional Office and to commend them for the improvements they've made in disability claims processing, and look forward to the day when we all meet our goal of having zero backlog and meeting our performance objectives. The first question I have, and you probably need this to answer this supplementally, is based on headlines that came out of my district last week, and that is because of the President's executive order to force contractors to pay a wage rate higher than the minimum wage, a veteran in my district was displaced from the nursing home in which he had resided for 5 years and forced to move to another one. And so I'd ask you to go back and to give us an analysis of the impact on the VA's budget of the increase in the minimum wage, and also, more importantly, of what the impact will be on the potential displacement of veterans from the nursing homes that they currently reside in. I think that was one of the unintended adverse consequences that's coming out from this unilateral increasing of the minimum wage. So that would be helpful to have that information. With respect to the IT budget, that is the chairman of the Economic Opportunity Subcommittee. I'm keenly interested in 2 IT systems that affect the economic opportunity for our veterans. The long-term solution system, which Mr. Takano asked about a few minutes ago, and then also the C-Winner system that deals with voc rehab cases. On the LTS system, and Mr. Warren, this question may be for you. As I understand it, you are investing only in sustainability and not into in additional capabilities. Is that correct?
Yes, sir. Today it meets the mission needs, and so we're making sure we keep it up and it's running, but there is nothing scheduled this year or next year to bring more capability online, sir.
Okay. I would asked the VA to go back and reassess two things. One is the performance objectives. I still have veterans in my district that are having to go through the original claims process, which is lengthy, and that's when they're just getting into the door of starting their GI benefits. And that's when the most frustration occurs, not only with the educational institutions, but with the veterans. So I'd ask you you as the organization to relook at that. I think for a modest amount of money, directed from probably VBMS, since that's where the biggest pot of money is, to look at just a little incremental improvement so that our original claims processing follows the rules-based system that you're doing in the VA that General Hickey has done so well. The second area is on C winners. Can you tell me what the amount of investment versus sustainment spending is going to be in the budget?
Sir, I do not have that at hand, but I can get that for you on the records.
Okay, that'd be great if you would. I think those would be interesting for this committee to know. And again, I would urge you to go back and relook at the objectives for the LTS processing, particularly with respect to original claims.
Congressman,
yes, sir.
We're happy to do that. I just, again, a little bit of history here. You know, we started out doing this by hand.
I know.
And it was tough just getting 173,000 youngsters in the fall term of 2009. And so we began building this without a clear understanding of what we needed, and we have built as we want. And as Mr. Warren says, what we have today seems to be meeting our needs. What we wanted was a TurboTax arrangement here where you could fill the bins and push a button and the calculations would be made and payments, would follow. I don't think we're there yet, so we'll continue to look at this.
Right. And first of all, this is not. I'm not being critical. I think you've come a long way with LTS. I'm just saying, I think for a modest amount of money, we could go considerably farther than where we've gone today. So I agree. I mean, from where you started, you had an immense task, and I think that you've made progress. But I would like to have an analysis of what we could get, particularly with respect to original claims, what improvement we could get, and for a modest amount of investment that probably wouldn't hurt the continued investment in VBMS. The next area has to do with VISTA. I think you're spending $269 million for fiscal 15, proposing to spend that. What does that compare to for this current fiscal year?
Mr. Warren.
Thank you for that question, Congressman Flores. The request in 15, as you stated, is approximately $270 million, and that is tied to VISTA evolution so that we can continue to evolve that world-class system. In the 14 budget, there's $290 million, but the majority of those resources are presently withheld while we bring our plan up to yourselves to lay out what is the future for VISTA evolution and what that long-term solution looks like, the plan. So when that plan clears, and I believe it goes to GAO per the NDA requirements, then the dollars will be released into us.
Okay.
So in the budget, but not released. So those resources are actually not being applied today, sir, and appreciate the support when the plan comes up to get the resources out so we can continue to evolve this world-class system.
Okay, so when we suspended evolution, we basically said $290 million is just going to be on hold while we figure out the direction we're going to go. And again, I'm not making a judgment, I'm just asking the questions.
It's 75% of that, sir, so we have some work underway to make sure we're continuing to meet critical healthcare needs. Undersecretary Petzel lays those out. We work on those, but the focus is continue that sharing of information and a clinical engagement. If you haven't seen that demo, I would suggest we can do that for you. The Janus viewer, it's doing great work.
Okay.
Continuing to evolve that as well as the
main systems. My time's expired. Again, I appreciate your service to our veterans, and Mr. Chairman, thank you for your forbearance.
Thank you, Mr. Flores. Ms. Brown.
Thank you, Mr. Chairman. Thank you very much. Before I begin my VA, I want to take off my VA hat and put on my transportation hat. And I have, let me just read this. As a Vietnam veteran and a supporter of our nation's efforts to ensure our veterans get good, important jobs after their service, we have set a hiring goal of 25% for veterans. Please accept this photo, and this is from the CEO, Joseph Boardman, president of Amtrak. And I have the painting here, and I would like the entire statement about how Amtrak and their hiring policy pertaining to veterans, and I would like the members to see the painting, and this was done at Beechwood Station, and I was very instrumental in keeping that station open, so I want to pass this around, and I would like to take a picture at the end with this painting that Mr. Boardman sent to you, Mr. Secretary.
Thank you.
Let me just thank you again for the VA hospital clinic in Jacksonville, the cemetery in Jacksonville. I mean, I'm very happy with everything that's going on in Jacksonville, and I am almost happy with some of the things that's going on in Orlando. I am just very impressed with the clinic that has opened up. We have about 123 patients there. It is one of the best facilities I've seen, and I've spent about 4 hours at the facility. I just want to know, when can we get that hospital open? You know, we've been working on it for 25 years, and I would like for us to get it complete. I spent a couple hours with the VA, a couple hours with the contractors, and it's just not there.
Fair enough. The construction there in Orlando is about 87% complete. What you listed were, the 120-bed community living center and a 60-bed domiciliary, all of that delivered and in good shape.
Beautiful.
We just have the main building left to do, and we're well along. Next to you, and maybe the chairman, most disappointed that this project didn't come in on schedule, and we continue to work with the contractor to get the work done that needs to be done. Right now, we're looking probably at summer of 15 is what the contractor is asking for. We have not agreed to that. We're still working with them. We'll continue to do that. What has been completed is great. We just need to get this project across the line. We're working very hard at this.
Thank you. And let me just say, I am very supportive of the chairman and the ranking member effort to get your budget completely forward budgeted. I know that we've done part of it, but I'm very interested in getting the entire budget, and it's waiting for the leadership to take it up at the House. I know once they take it up, we probably will have 0 votes against it. You want to say anything about it? Because in some areas, I mean, you don't need to go with the whims of the House when we can't come together on a budget, but at least it's always comforting to know that the veterans budget is not included.
Well, I would begin by thanking the members of this committee. We have advanced appropriations for our veterans health care. You have provided that to us since 2012. We have learned a lot in the advanced appropriations arena, and we do that piece quite well. And it's a good fit for Veterans Health Administration. As I testified to in October in this very room, what I have learned since is that in the area, for example, and by the way, veterans health care is about 80% of the budget. And so maybe even 85%. For the remainder of the budget in one specific area, processing of claims, I can't do it internal to VA. We've done a lot of work in the last 5 years to create a relationship with DOD, and it's a very good one. We now get service treatment records electronically. Prior to this, for centuries, it was a paper exchange. And so we've made a tremendous adjustment here. We still have to go to the Social Security Agency to validate other disability payments. We have to go to IRS to validate threshold income levels. We still work with Department of Education on 9/11 GI Bill, and as I said, DOD. And so I would, as I did with great deference during the October testimony, say that what would be most helpful to VA is for us to get for the federal government to get a budget every year, because my ties to these other departments, even if I have advanced appropriations for this department, doesn't quite get done the specific work that needs to be done in the benefits arena. And for example, our concerns, I mean, this committee's concerns and our concerns and testimony were that if Treasury, for example, wasn't funded, the checks that we would have, the tapes we would have passed that would have resulted in checks being cut would not have happened. So this is, this is a bigger discussion in some aspects than just the VA budget. But I appreciate the question.
Thank you very much, and thank you for your service.
Thank you, Mr. Brown. Mr. Huelskamp.
Thank you, Mr. Chairman and Secretary. Thank you for being here today, and I appreciate your latest comments in reference to actually having a budget. It's important to note as well the President was a month late on his budget this year, and which is that much later. But I have been concerned. Both houses, leadership in both chambers, have not brought many parts of the budget to the floor for debate, and a lot of it's left in the committee or in subcommittee. But I do have one particular budget question. Do you have a rough count, a general idea of how many public affairs employees are funded in your budget?
I don't here today, but I'm happy to provide that for the record.
All right. CFO, any guesstimates on that at all? We'll have to wait for any range on that.
Yeah,
okay.
I regret I don't
Okay.
have that.
Thank you, Mr. I appreciate it, Mr. Secretary. And the reason I ask is I have a list here of nearly 70 different instances in the last year to year and a half in which your agency has failed to respond to requests for information. And these generally are from media requests and some very specific questions, and the answers are always no comment, no answer, no response. What level of transparency do you expect, and what are the roles of these public affairs officers, other than to say, we can't answer that question now, Mr. Secretary? I'm very concerned about transparency. We've had numerous hearings on things in which the agency was not very responsive, even before the committee. So if you could share your thoughts on that.
Well, as I stated in the beginning, and it's probably prior to your arrival, Mr. Huelskamp, transparency is an important aspect of our being able to establish and retain trust in this department. It's a high item on my list of things that we commit to, and I regret that you apparently have some data here that I need to get into. I'm happy to do that.
Excellent, and appreciate that. So will you commit to directing your employees to do a better job responding to these inquiries, whether it's from Congress or members of the media or of the public?
I will do that.
Okay, well, thank you. And I do also have a report specifically in which I've not seen comments from your agency, but a January CNN story that had identified at least 19 preventable veteran deaths due to delays in simple medical screenings. Are you familiar with this report, and what is your reaction?
I'm familiar with what was reported in the press, and I would begin by saying that any time we lose a veteran under circumstances that we can't explain, even though our veterans are amongst the oldest and sickest patients, anytime we have a death, it's an issue of concern with me, and I look for the factors that might have contributed to that. I would say every one of these incidents reviewed and investigated. I think what we need to recognize is many of those reports originate from inside VA, and I'm pleased that we have employees who are honest and courageous enough to call themselves on something they either saw or might have committed. And it's because of that kind of transparency on the part of the workforce that we're able to pursue some of these issues. Doesn't mean that we are without having made errors, but if the reporting continues, we can do something about it. And that's what I think is important to be retained here. That's part of our discussion as well.
Yeah, and I appreciate that. That's a great comment on that. But you have the employees that reported that, but have any employees been held accountable for these preventable deaths?
I can certainly turn to Dr. Petzel for these specific 19. We do hold employees accountable. I would say, Congressman, that in 2012 we involuntarily removed over 3,000 employees. In 2013 we involuntarily removed another 3,000 employees, and then over the past 2 years, 6 members of the senior executive service have been dismissed as well.
And I'll look forward for that response for the committee. I don't want to take up any more time, but if I might ask Mr. Warren an IT question, Mr. Chairman, can I?
We're really running out of time.
Okay, I will hold that till next round. So thank you.
We're not going to even have a second round. I mean, the Secretary's been very gracious with his time. If you could, we'll put a package of questions together for the record, and we'll do it that way. Thank you, sir. Mr. Negrete McLeod.
Thank you, Mr. Chairman. Mr. Chairman, homelessness among veterans is a serious problem in California and in my district. An issue not mentioned about the per diem program is that these funds cannot be used to help children who are under the care of a homeless veteran. It is for this reason that last week I introduced H.R. 4140, the Homeless Veterans with Children Act of 2014. This bill doesn't cost any money. It just gives the VA more flexibility on how to use per diem funds to help homeless veterans. Mr. Chairman, I hope that H.R. 4140 will be included in our Sub-Health Committee legislation hearing this spring. Helping homeless veterans with dependents is an issue that has been identified by the VSOs and needs to be fixed now. My question is, how is the VA working with per diem recipients to ensure that they have the protection of privacy for homeless veterans?
I'm going to ask Dr. Petzel to address the per diem question. But Congresswoman, this is in discussing the homeless program. This is one piece of that. I think you're familiar with the HUD-VASH program, the HUD-VASH voucher. This would be another example, Mr. Chairman, of where our working relationship with another federal department for us to get our work done. The HUD-VASH voucher is key to this, and it's the most versatile of our options that we can provide to the homeless. And in fact, it does care for families and for children. And in the case of California, I think we have about 9,500 HUD-VASH vouchers already in place, in addition to the per diem grants that we provide. Dr. Petzel.
Thank you, Mr. Secretary, Congresswoman McLeod. Excuse me. The two programs, the grant per diem program and the supportive services for veterans and families, are really the important parts of our providing transitional housing for these veterans who are on the streets, and for the families of those unfortunate people who have been unable to maintain themselves in their home. We contract across the country. We spent $300 million in the grant per diem program, $300 million last year in the supportive services. We're trying to increase that to $500 million in the fiscal year 15. In those contracts, there are provisions for maintaining the privacy and the security of the people who use those services. Tangentially to your question, I would point out that there is a growing need in this country for grant per diem housing for women, and for families. There are plenty of opportunities for men. And the VA, I'm proud to say, has been a leader in facilitating the development of grant per diem housing and supportive services programs for women in a number of places around the country. And I think we would be viewed as one of the national leaders in recognizing the need for women and the need for special, secure, private arrangements in these circumstances for women.
Thank you. Thank you, Mr. Chair.
Thank you very much. Last question for the day. It comes from Ms. Wolarski.
Thank you, Mr. Chairman. Ms. Secretary Shinseki, good to see you. Just quick question. IT security is 6% of your budget, and your 2015 budget seeks $33 million over the 2014 budget for a total of approximately $189 million for IT security. Will that amount finally assist the VA in addressing the numerous IT deficiencies that we've brought to the attention of the VA?
Let me ask Mr. Warren to address that.
Thank you. Thank you, Congresswoman Wolarski. Yes, we take information protection very seriously, and the resources that we've asked for will allow us to keep up with the evolving threats that all of us face.
Thank you. And Mr. Secretary, the NDAA, as somebody alluded to earlier, explains that neither the VA or the DoD can spend more than 25% until the secretaries brief the appropriate congressional committees on their plan. And I know that the VA and the DoD did provide a brief to the committees on January 27th, but there were key elements that were missing that had to be included in that report. I understand the plan that includes the missing details is awaiting clearance at OMB. Do you know when we might receive that information?
Let me call on Mr. Warren.
We believe that plan will clear in the next 30 days. We want to make sure that it is responsive to the questions in the NDAA, but not only responsive, but answers the questions in a way that are understandable. So we're making sure when it comes over, it meets the need so that we can get the dollars released and start working on VISTA evolution. And appreciate your support for that, ma'am.
And will the committee receive the Interagency Program Office interoperability report sometime in that same time frame?
I believe we've already done one quarterly report. The next quarterly report is going through review, and so that should be coming out, I believe, in the next 3 to 4 weeks, and it's a joint report of the two departments. And again, we want to make sure we're responsive to your requests.
Thank you. And then finally, I'd be remiss if I didn't ask about the CBOC in Indiana 2nd District. That is a familiar conversation here. When I was in your office just a couple of weeks ago, we'd received an update that the lease would be awarded winter of 2013-2014. And is that still the latest update? Because we just received a report last week outside of the VA that there is potentially a delay now until summer of 2014.
Let me ask Dr. Pitzel.
Thank you, Congresswoman. The project is proceeding at pace. There was a NEPA study that needed to be done, an environmental impact study that revealed originally some issues with potential artifacts. That has been taken care of, and the evaluation is proceeding.
And so is it still on track for winter/spring if winter ever ends up there?
Yes.
Okay. So there has not been, we were just made aware last week that there's a possibility that the VA has asked the bidders to refresh or update their proposals. Is that true, and that they have 30 days to do that?
I will have to go back and check for the record, Congresswoman. I am not familiar with that detail.
Okay.
I would not be surprised if there's any lengthy delays. We want to ensure that the bidders have the best information in the competition at the end before the decision is made. So this is something that occurs from time to time.
Thank you, and thank you, Mr. Chairman.
Thank you much, Mr. Wolarski. Mr. Secretary, thank you for being so generous with your time. Thank you to the undersecretaries for being here with us. Of course, there will be some follow-up questions for the record. I would ask the unanimous consent that all members would have 5 legislative days with which to revise and extend their remarks without objection. With that, this hearing is adjourned.